Hi, and welcome to Matt Holman Talks Mental Health, the podcast where I have the opportunity to sit down and chat to amazing humans about their stories and their journeys. For this episode, I'm so happy to introduce Julia Bray to the conversation. Welcome, Julia.
Hi, nice to meet you.
Hi, nice to meet you. It's like we've never met before, but we have met, right? So it's so nice, and we've done the sort of the pre to this recording, and I just love listening to stories. And this one I know is going to be an incredible story and journey as well. I won't give too much away. I'll let Julia do the introduction in a second. But this is one that has been on the list for me for a while, and I'm so pleased that we got to this recording. Julia and I have known each other for a little while, not too long actually. We've met a few times, sort of in person, with different events and things that we've been attending. And yeah, I know the story, so I'm just going to let you just give a very quick introduction, Julia, to sort of where you are and who you are.
Yeah, thank you. So my name's Julia. I'm Head of Education Services at Inclusion Education. I'm a mum of two lovely children, a young girl and a young boy. And I'm extremely passionate about all things, children, education, progression, and, resilience. And I think we'll talk a little bit more about that in a moment.
We will, and we're going to hear about your resilience as well and your personal story. So, as always, welcome. Tell us a story, Julia. Tell us a bit about sort of your life and what's been going on and some of your journey with mental and physical health.
Yeah, so I think for a couple of years I've struggled with, I say, abdominal medical problems. But it came to light about a year ago that there was quite a significant issue that hadn't been identified. And I'd spent, I think it was about 2 weeks in hospital with bowel issues, abdominal issues, and I was given 7 days notice for quite a significant operation. And it was quite a lot to take in. I'd come back to work. I just got back to work, and back into the lifestyle of being a mum and a teacher. And then I got a phone call to say you've got 7 days. You'll be coming in for what was called a subtotal colectomy. So I was having a large portion of my bowel removed. And it was explained that it was quite a serious operation. I think at the time it really took me back. I think it was the first time I've ever really cried a lot at work. And I said to my head teacher, who was just incredible, but I said, I've got to go. I need to go to my children's school. That was my first thought, was how are the children going to cope? There's no time for me to process this, let alone my children. So with his permission, I was allowed to go. I went and spoke to my children's school immediately. And I just explained that I was having, quite serious surgery,
Yeah.
but I hoped to be out within 2 weeks. But I felt that my children would need support, pastoral support at school, because it's a big thing to go from having mum and dad at home all the time to just dad. And I was also told that I wouldn't be able to see my children for a period of time, because they had to be 12 in order to visit at the ward. And both of my children are a lot younger than that. So there was a lot of worries, a lot of concern, but also it was Christmas time as well. So it's the beginning of December. So there was a lot of worry, there was a lot of concern about all things Christmas, family, how my children would cope. I was worried about work, but I had that security that everybody at work, when they were saying, go and have your operation, get yourself better, look after yourself, I had that psychological safety that I knew they meant it. So whilst I was worried about taking time off work, I knew that it was going to be okay. So with that in mind, I had 7 days to kind of get myself ready. I still went to work. I still got everything, still ran everything at home as it should, because I wanted to keep that normal routine. And, I was assured that I'd be home for Christmas and that I didn't need to worry and I didn't need to panic. So fast forward 7 days, I had the operation. Everything was fine initially. But I started within myself. I just knew something wasn't right. And I think when people say, listen to your body, you know your body better than anybody, that's the biggest thing that I've taken away from all of this, because I kept saying something's not right. I just know something's not right. And what should have been a 9-day admission got longer and longer and longer. And I fell incredibly poorly before Christmas, which meant that I missed Christmas with my children. was devastated. It really, really took its toll on me. And I could see that it was taking its toll on the nurses that were looking after me as well, because they could see the pain I was feeling as a mum, as well as obviously the pain that I was in physically. So all of that happened. And I was then transferred to a specialist ward because the pain was just uncontrollable. We weren't sure what was going on. I had some kind of infection. But it was only when I had a CT scan, or no, if I rewind a little bit, I was on a morphine pump, and I was really worried about this morphine pump because I felt like it was masking the pain. And it was only when I came off the morphine pump that we went for a CT scan because something just wasn't right. And it was at that point we realised that I had a large abscess on my ovary. And it was only when I got rushed to theatre that we realised that it had actually infected the whole of my stomach. And I was in theatre for 6 hours. It took 10 litres of fluid to unstick all of my organs. And unfortunately, I then lost both of my tubes and a set of my ovaries. And that was by far the worst operation. That, it was worse than the operation before. I had drains coming out of my side. It took 3 or 4 people just to help me get off the bed to go to the toilet, and it was just a really, really difficult time. And in the middle of that, it was, I was a mum, and it was just really difficult to not see my children, but do the things that for me made me feel like I was a good mum. Fast forward a few more weeks, still was quite poorly, and then rushed to CT again to find out that the ovary they had left had grown a cyst and had stuck itself to the bowel. So I needed to go into surgery again. So I think that was the third surgery. By that point, I was significantly losing weight. I think I'd gone from 74 kg to, it was about 51 at that point, and it was just dropping and dropping and dropping. I slowly started to get a little bit better, but we just knew something wasn't quite right. I managed to go home. I got home for 2 days. I'd been discharged, but I only managed 2 days at home, where I then got rushed back into hospital. I then had a CT scan, which showed that I think that one, there was quite a few, so apologies. That one, I had a fistula between my bladder and my bowel. And again, I was just convinced that something was happening that was an underlying cause. I couldn't understand why I just kept needing all these operations. And I was convinced there was a leak. I was convinced something had been caused that hadn't been picked up on. And it was at that point I was told I needed a stoma. The thought of having to have a bag on my hip that collected my waste was just, it was frightening. I was petrified. I was worried about leading meetings at work and it making a noise. I was worried about it possibly leaking, which I was told was a rarity at the time. I was worried about the smell, which again, there isn't a smell, but there was just so many emotions that I was going through. Not to mention, obviously, worrying about not being at home, worrying about my partner, worrying about my friends and my family seeing me so poorly. But again, I didn't need to worry about work. I had my head teacher, business manager, CEO, I had SLT, they were all coming in to see me. And had we not said to other members of staff, just wait till she's a bit better, I would have had a lot more members of staff coming as well. They were just so incredibly supportive. But it was at that point I needed stoma, and I had it, and I woke up and I was a different person. I felt different. All of the problems had gone, all of that pain that I'd experienced for several months. So this had been going on from December all the way through to April. And it was operation after operation, and it was pain, the exhaustion, the not sleeping, the not seeing my children. There were days that I was really, really low. There were other days that I was a lot higher and felt a lot better. I played for 2 netball teams at the time, so there was at least 14 girls coming in and out all the time.
Yeah.
Not to mention my family, not to mention, I was then able to see my children because I had my own private room and my friends from school. So I've never felt so loved. I had so many people around me. The support network was incredible, but it didn't take away from the fact that it was tough. It was really, really tough. And one day, it was 2 days after I had my surgery, I wasn't well. I was being sick, and what I remember is, sorry to be too graphic, but I remember being sick, black sick. And the nurse kept saying, "Oh, it's because of your Ribena." And I had Ribena on my desk, on my table. And I was trying to explain to her, that's Dan's. Now, Dan is my brother. So I was saying, that's Dan's Ribena, that's not my Ribena. Now, this nurse had never met my brother. He had visited from Devon, and she hadn't seen him. She hadn't realised he'd been there. So when I was trying to say that's Dan's, she couldn't really place it. So it wasn't really being taken seriously, that my sick was a colour that it shouldn't be. So when my sister came in, I'll be honest, she hit the roof. I was clearly very poorly. That day in particular just happened to be what we call a mummy day and a daddy day. So one of the children goes with mum, one of the children goes with dad. They're always planned. But because I was in hospital, my daughter was with my mother-in-law and my son was in London with his dad. So they didn't really realise that I was as poorly as what I was. I'd said I hadn't slept, but just give me a couple of hours. So it was only when my sister arrived, she thought, hang on a minute, something's really not right. So with that in mind, doctors were called, I was rushed to CT, and they found, I think it was 2 to 3 litres of blood in my stomach. So by this point, I was having blood transfusions. I'd already had sepsis and, all sorts of drains and things leading up to this. So yes, so it was quite difficult. I was being told I was being rushed to theatre. There was quite a serious leak. There was lots of, at the time, they were saying, you've got poo in your abdomen and we don't know how. You've clearly got peritonitis. We don't know how. So my partner's trying to rush to get back from London. The trains had, there were delays. My family were in Devon, were trying to get to me. And it was at that point that I think they realised it was quite serious. So I was rushed to theatre. My surgeon, bless him, cancelled his holiday. He was due to go. It was Easter. He was due to go on holiday, and he stayed. And it was only when I got to theatre they realised that my lungs were only working at 20% capacity. So I had fluid on the lungs. I had a terrible chest infection, but they still couldn't find the leak. So they managed to remove all of the blood. They managed to remove things that shouldn't be there. But it was made to keep me the decision was made to keep me sedated because they couldn't find the leak and they needed other specialists to come in the next day to try and open me up. So by this point, I'd gone from a small incision to several keyhole surgeries over a period of months. But at that point, I was then opened, huge incision, top to bottom, to try and find what was causing this leak. And so if I get upset, I was told, my family were told I had 1 to 5% chance survival. So I was rushed to theatre the next day. I was in ICU, rushed to theatre, and they'd found the leak. And what had happened, they hadn't necessarily sewn up the stoma properly. So whilst waste was going in the bag, waste was also going through and leaking into my stomach. So I think I spent about a week in an induced coma whilst my body kind of fought off all sorts of infections. I'd had sepsis multiple times over the period of months, so I'd had lots of antibiotics, and it was almost like my body had got to the stage where nothing was working. One of the conversations, which I've now been told now I'm better, was, my family were told this is the last antibiotic we can try. It's like a bleach. It almost bleaches the body. Whatever's causing it, we need to try and get rid of it. And thankfully, I pulled through. So it was a bit of a crazy few months. And I think for me, I was completely unaware of how poorly I really was. I think the most difficult thing was, now I look back at it, was to see the impact that it had on those around me. And what they could see was different to what I could see. I was losing weight. I think I'd then gone from 74 kg to about 49. So this whole time I wasn't eating, I was tube fed and things like that. So they were seeing a huge change in my weight, all the machines, the whole wall in ICU was just full of machines behind me. I was obviously intubated for a period of time. So it's that which was quite is difficult for me now to think about, you know, because that's what they were seeing. And it was only when I got moved back to the ward, I just remember my CEO coming in and bursting into tears. And it was at that point I thought, I've clearly been quite poorly. I hadn't processed anything at that point. And you know, I'm forever grateful for everybody that visited me, supported me, and got me through. Because I think without them and without that determination and that resilience and that push to be there for my children, you know, I don't think I would be here. I would be here today. So, you know, sorry, it's a very long
No,
long
not.
explanation. But it went from December all the way through to April of repeated operations. I then got home for the summer holidays and I was back in theatre in October, having my stoma fixed.
Yeah.
But it's one of those things now. I just bounce back from it, and I use that challenge and that adversity to now teach other people about stomas, what they are, what you might experience, and so on and so forth. And I'm back doing the job that I love as well. So it's and being a mum, and more importantly, so it's great.
Oh my God, you're an inspiration, Julia. Genuinely, your story is so traumatic but so real, and I think that's the reality, isn't it? Of, you know, this is the journey you've been on with this experience. I need to venture somewhere with this. You know, it's like, where do you start with a
Yeah.
conversation? You know, what's it mean and how does it work and everything else? Because we want to talk
Mm.
about that too. But just a very quick question before it all became the reality of, you know, the operations, the challenges.
Yeah.
Sort of, where's your resilience come from?
So as a youngster, I grew up in the care system.
Okay.
So I was fostered, and I think, you know, before you become fostered or before you're removed from your parents, you don't really realize that things aren't as they should be, because you only know what you think you know. And that's, you know, anyone watching this that knows me will know that's my favorite line. You only know what you think you know. And when you're young, you learn to survive, you learn to cope with those things. And I think because that was my mindset growing up,
Yeah.
and I had very strong siblings who had the same mindset as well, I think that just made me into the person that I am. And for me, it was my PE teacher who was really that role model for me, who supported me to university. I was the first person to go to university, and anytime I really struggled, I would contact my PE teacher to say, oh my goodness, this has happened, or I'm really struggling with this, or I can't do this anymore. And they were so supportive. And that's why I then went into teaching. And I think I've just ended up, you know, that all of those experiences have built me and shaped me as to who I am. And
Yeah.
yes, I think that in itself has been a huge positive, because it's given me that resilience and that determination and that drive that had I not gone through that, I wouldn't have had. So that's where it you know, stems back
Yeah.
from,
Well,
really.
that's, you've answered my origins question, you know, where did it come from? And I think that, and thank you for sharing that as well. I really, really respect and appreciate that. And I think that, yeah, you know, that's the fight in you was born through experiences, no doubt, that you've been through. And as you sort of come through the other side of this, you know, sort of, how did you get yourself back on track with this? You know, because I know you said you're back working and you've got this, you know, this community that you're building around sort of, you know, awareness. But what was your, you know, how did you energize those thoughts?
I think for me, routine was the biggest thing.
Okay.
I just needed to have that purpose. I needed to have that routine. Um, and I needed that flexibility to do what I needed to do, but at a rate that could go up and down.
Sure.
And you know, I had a really supportive, or have a really supportive employer. So it was a case of do what you can when you can,
Yeah.
but we understand this is just as important for you to be here. So I think I had such a great, and still have a great support network at work, with everybody, and a great support network with family and friends. You know, helping clean the house because there's still things, you know, I still can't do.
Yeah.
But more importantly, I think, you know, my partner's been my rock throughout all
Brilliant.
of this, and also my children. And, you know, they've almost learned a set of skills and resilience and drive and determination through what they've been through. And, you know, I'll have that guilt, I think, as a mum for a long time, that not that I put them through it, but they had to experience it.
Yeah.
But I think all of that has been my drive. All of that has been my support network. If my children can still get up and go to school and still do those things in times that are really tough for them and really uncertain for them, and if my partner can still pretend that everything's okay
Right.
and hide the fact that mummy might not be coming home at all and still do what he needed to do, then that's my why. If they can do that, then I can certainly get up and get back to normal or get to a new normal.
Yeah, sounds like you got a good team there, right?
Yeah,
A good
absolutely.
team. And the children, they're doing okay?
Yes, they're doing really well, really well. And I think there will always be that bit of worry of, is mum going to,
Yeah.
be poorly again and or what, whatnot. But we have those open discussions. They learned what a stoma was immediately. We were given a bear with a stoma and some lovely books
Yeah.
provided by a charity called Botany the Bear. And that's really helped them. And again, it's filtered down because they've taken them to school. School have supported them. They've then shared, show and tell with the teddy bear and with the books, and the
Yeah.
schools have read the
Yeah.
books. So it's become the normal way of life for them.
Yeah.
Um, get upset. And my son said to me, he said, Mum, it's not a disability, it's a hidden ability. No, it's a special ability.
Right.
And, for a 7-year-old to come out with something like that so powerful, I don't know who taught him that, but again, that's my drive. If a 7-year-old can have that outlook on life and something that was so negative, then, anyone can get through it.
You're right, and I think that's it, isn't it? It's that sort of reminder of the human resilience and the bounce back ability we have sometimes when things seem to be just going into the hardest of places and some of those challenges. So you also have a little TikTok channel, don't you? That
I do,
you
I
put
do, yes.
really interesting. Sorry, I brought it up. I
That's
know
okay.
other channels are available, but it's just an interesting sort of understanding and awareness that you're raising, right?
Yes, I think when I first got my stoma,
Mm,
you can be told things by a doctor or by a nurse, but it's the same as driving. You only really learn when you're out on your own.
true. Yeah.
And there's so many things you're not told as well, not because people aren't doing their job, because it doesn't, unless it comes up, you're not exposed to certain information or situations. And I found that signing up to TikTok and following other ostomates, people with colostomies,
Mm,
ileostomies, urostomies, following other people and seeing their journey really helped me.
yeah.
And just something as simple as seeing them change their bag. And I initially really struggled to look at my stoma.
Right.
I thought I was ready to accept that I had one, but the one piece of information they don't tell you is that yes, your intestine is sewn to your stomach, but it moves. Now, no one tells you that at all. So I remember waking up, looking at it, thinking, what on earth is that? That doesn't look like any of the photos I've seen. And of course, photos don't move. So to see the what it is like for others and how it differs for so many other people was huge. Using it for advice as well. I had one night where I was very, very poorly. I didn't realize I was poorly at the time. I just thought it was normal. I posted pictures of all these different bags that I'd gone through and said, is this normal? And people were replying, nope, eat jelly babies. And I thought, oh, right, okay, why jelly babies? And they were saying, oh, because of the gelatin, it stops your output. It can, and again, I learned just through posing, or asking
Yeah.
questions,
Yeah.
and I've learned so much. So I now do the same for others. It took me several months to be able to even show someone my stoma,
Yeah.
whereas now I will openly show what it looks like to change your bag, what different, pieces of equipment you might use. Whilst I'm not confident enough to do a talk over like other people and things like that, I've gone from not being able to show it at all
Yeah.
to showing my stoma. So I can see I've made progress. But I think it's more important to show everybody the good, the bad, and the ugly of having a stoma. And, to be able to demonstrate that you can work. Yes, you've got one, but there are adaptations that your work can do. There are things that you can do. And actually, it is okay to say, I've had a really bad day. And
Mm,
it is okay to say it's okay not to be okay. I'm very positive. My LinkedIn channel is totally different to my school, my teacher Twitter, and that's totally different to my stoma page. but for me, it's an outlet and raising awareness, because again, so there's so much about stomas that people don't know. For
Yeah.
example, I had no idea that there was a difference between an ileostomy and a colostomy. So learning those things and then being able to share them and answer questions helps me get through, but it also helps me pay it forward, because I've learned more from others than I have from any health professional.
Yeah. So important as well, isn't it, to have that, and you find in your community. And what was it you said about the group that was mates or something? Was it
Ostomates.
foster
Yes,
mate? Is
ostomates.
that
Yes.
official
It's just an
terminology?
official term that's on
Okay.
social media. So anybody with an ostomy, whether that's an
Oh, right.
ileostomy, colostomy, urostomy,
All right.
the word
Like a
that's used
community called the
is
mate.
ostomates. And it's very much a community.
Yeah.
But to be part of a community that understand
Yeah.
is huge. You know, to be able to say, I was poorly last week and the week before, to be able to say, my goodness, is this normal? My bag is exploding while I'm at work.
Mm.
I can't cope. What on earth is going on? And we went through, different pieces of advice, and it turned out I had an infection, but it made me feel better to know that other people do go through it,
Yeah.
but it is a rarity. So again, there was that reassurance that I'm not going to spend the rest of my life having difficulties while I'm at work and having to go home, or being fearful that I can't go out to a theme park, for instance. It's okay to feel anxious, but there are things that can actually stop you feeling anxious, so you can still do all of those things. So being part of that community really, really helps. So it's now about spreading the awareness, and making it known that yes, I'm very open. I've got one, and I'm proud of having one. And if it wasn't, for my stoma bag, I wouldn't be here today. So it's something I'm incredibly grateful for.
Yeah. And I know so many people around you that support you feel exactly the same way, right? But he'd
Absolutely.
rather you be here with us, and you live with this experience that you've been through, and move forward. And the things you're doing to move forward with that are great. And the work that you're doing and the support you give, and I love the inclusion educational approach to everything as well. And you're in the perfect place for that support as well, right? So
Oh, absolutely. And I know just how lucky I am to have the supportive workplace and employer that I have. Because if I think back to, other settings that other friends and family might be part of, I know they wouldn't, and they'd openly say they wouldn't get that support. So I know that, my employer's played a huge role in all of
yeah.
this. I've been able to really focus on getting better. But also, it's not just been about me. They've really thought about my children, my partner. My children have had presents from the therapy dog at the school and things. And, it's just this,
Yeah.
they've thought about absolutely everything,
Right.
which has been incredible.
That's amazing, and no doubt you will pass that forward and pay that forward in so
Absolutely.
many ways to help and support other people. Julia, we are coming right to the end of this now.
Yeah,
I told you it would fly by so
it
quick.
did. It did
Um,
indeed. I felt like I spoke lots. Sorry.
no, that's the idea. Nobody wants to hear me. They just want
Yeah.
to hear the story. And what an incredibly powerful story it is. And in such a short space of time, the journey you've been on has been unbelievable. To think where you were,
Mhm.
less than 2 years ago and where you are now, they're two very different people, right? So you've done
Indeed.
you've done
Indeed.
amazing. But I will hand it over for final thoughts from you. Any messages you want to share? Any quotes you like? I love the one that your son put to you. But have you got anything that sort of you hold on to as like that's my thing, that's what I believe, and that's what I love? So
I
over to you. Final thoughts.
Yeah, I always say to people, you only know what you think you know. So if you're worried about something or you're unsure about something, definitely reach out and talk to others, because it's not always what it seems. My thought process and interpretation of a stoma is totally different to actually what it is.
Yeah.
And I apply that saying to absolutely everything: work, family, friends, health, absolutely everything. So that's, for me, is definitely one of the key things. And also, it's okay not to be okay sometimes. It's okay to have a dip, and that's life and that's normal. But the best thing you can do is just communicate it, and let those around you know that's how you're feeling, and they can help you rise up.
There's about 5 or 6 quotes in there. Thank you for that. I'll let the listeners break them all down. But it's so true. You don't know. It's okay not to be okay sometimes, but
Yeah.
the key is about recognizing and taking action to it. So listen, thank you so much for coming along and telling your story and sharing your insights and imparting your wisdom and knowledge. You have helped me to learn more about this than I knew before. So, mission accomplished in terms of sharing. Helps us to learn, right? And helps us to understand and appreciate things. So thank you. Really, really appreciate it. For anybody that is listening, if you would like to know more about Julia and her little journey with Stoma Mum on
Mhm.
TikTok, or the work that she does with inclusion, we will make sure to tag her in this post as well. And so please feel free to get in touch with Julia or connect with her, or whatever it is, in whichever mode and mechanisms you use for your social content. But Julia, it's been an absolute pleasure. I wish you all the very best on your journey, and I look forward to seeing you at some point soon, no
Yeah,
doubt. If I pop my head into inclusion somewhere. But take care of yourself. Thank you so much.
brilliant. Thank you.